Hi friends, whenever diagnosis of cancer happens, the targeted therapy and immunotherapy words rolls in. So what is targeted therapy and immunotherapy? To discuss that, I am Dr. Amit Chetani, oncophysician at Century Cancer Hospital, Rajkot, is here to discuss that. Before discussing targeted immunotherapy, we need to discuss about how chemotherapy works. Chemotherapy acts at DNA level. Either it breaks the DNA or it produces its DNA at death, or it affects the metabolism of the cancer cells. So it affects the all highly proliferative cells. Cancer cells are highly proliferative, but it also affects the other highly proliferative cells like hair root cells, oral mucosal cells, intestinal mucosal cells, blood counts. So secondary to that, patient have a secondary side effects like hair loss, oral mucositis, nausea, vomiting, diarrhea, low blood counts and infection. But in targeted therapy, the targeted therapy works at antigen of the cancer cells or at the receptor of the cancer cells, or occasionally it inhibits the pathway in cancer cells only. So targeted therapy is more or less cancer cell specific. It could be either in oral form or it could be in intravenous form. The example of the oral form targeted therapy is in lung cancer, gefitinib, crizotinib, and intravenous form is rituximab in lymphoma. So the targeted therapy acts on cancer cell only, but it has also few off-label targets, and its receptor are also present in normal tissue also. So it is also not devoid of side effects, but the conventional side effect like hair loss, very much vomiting, very much low blood counts won't be there. So this was about targeted therapy. Now if we discuss about immunotherapy, then we have to understand the function of the T cells. T cells have many receptors on their surface. Few of them are excitatory for its function, few of them are inhibitory for its function. So what cancer cells do, they activate the inhibitory receptor, and so T cell become less active. So in turn, T cell cannot activate our immune system to act on cancer cells. So this way cancer cell escapes from our immune system. But the conventional immunotherapy like nivolumab, pembrolizumab, atezolizumab, what it does, it blocks this interaction through PD-L1 inhibition. So T cell remains active, and in turn it activates the other immune system cells and which act on cancer cells. So this immunotherapy is very much effective if PD-L1 is more than 50% in lung cancer. In other cancer like head and neck, in endometrium, in liver cancer and other cancer, it is also effective, but generally as a single agent it is 10 to 30% would be its response rate. It can be combined with chemotherapy and it may give good results. So that was about conventional immunotherapy. Now CAR T cell therapy and BiTE cell therapy are also part of immunotherapy. CAR T cell therapy is chimeric antigen receptor T cell therapy, where the cancer antigen associated receptor is engineered over T cells. So such T cells get activated when they come in close contact with cancer cells, and they releases the cytokines, and that way it kills the cancer cells. So at presently CAR T cell therapy is available for liquid malignancy only. Like in lymphoma, it is axi-cell, lisa cell. In multiple myeloma it is silta cell. So that was general information about CAR T cell therapy. Now if we discuss bitherapy, that is bispecific T cell engager. Here the antibody is bispecific and it binds with antigen of the cancer cell as well as antigen present on the T cells. So it makes T cell closure to cancer cells and activate the T cell to release its cytokine. So that way it acts on cancer cells. The example of BiTE therapy is blinatumomab in ALL and many more in other malignancies. So that was about bitherapy. So this was the general information about targeted therapy, immunotherapy. Thank you.